comparing the two were inconclusive. In 2020, there was a meta-analysis of 50 trials and 12,000 participants, and the quit rates were higher with the e-cigarettes than with the nicotine replacement therapy. So what can we say good about e-cigarettes or vaping is that e-cigarettes may be beneficial in reducing the number of conventional cigarettes smoked in adults who are already smoking. The question is, will replacement of e-cigarettes instead of conventional cigarettes lead to a reduction in tobacco-related illnesses? And the answer is we don't know. We've had about 500,000 deaths from COVID. Is that correct? Or about 500,000 deaths from COVID? So every year, 480,000 people die of tobacco-related illnesses. That's every year. So that includes lung cancer, COPD, which is bronchitis and emphysema, cardiovascular disease from smoking, esophageal cancer, bladder cancer. So we get that every year. Almost 500,000 people die every year from tobacco-related illnesses. So what are the long-term effects of e-cigarettes? The answer is we don't know. And I'm sure we will know in 10 years or 20 years, but we don't know right now. Whether the effects of secondhand smoke or secondhand vapor, because it's not smoke, the answer is we don't know. So again, that's to be determined. It took us a long time to figure out the effects of secondhand smoke from cigarettes. So for the first part of my career, when I would shrug my shoulders if somebody asked me, if their husband or wives smoking was affecting them, and there's no question now, that secondhand smoke can cause lung cancer. Secondhand smoke can cause COPD, which is chronic bronchitis and emphysema. It can certainly exacerbate asthma. So there's primary smoking, which is you smoke a cigarette and inhale the contents. There's secondary smoking, which is the person next to you that is in your exhaled tobacco mist gets the smoke. There's third hand tobacco exposure. Anybody know what third hand tobacco exposure is? First hand, you're smoking. Second hand, it's the guy next to you. Third hand, it gets into the environment and the walls.
Oh.
So I have to tell you that my just a personal story, that my wife's parents, my father-in-law smoked. Wonderful guy, World War II veteran, was in the Pacific. But he smoked 3 to 4 packs of cigarettes per day.
Wow.
And his mother probably smoked 3/4 of a pack of cigarettes per day. And when we went to sell their house, which they had lived in for like 30 years, the walls were permeated with tobacco. They were yellow and permeated with tobacco, and the pictures on the walls were yellow from tobacco. So that from the smoke. So that's third hand smoke. It kind of sticks in the environment. Okay, how dangerous is that? I don't know.
It's like tar almost, right?
Yeah, and there's fourth, and now there's a fourth hand. You know what that is? This just came up. Fourth hand is butts, cigarette butts in the environment.
Oh.
Yeah. Supposedly there's like 6 trillion cigarette butts that get thrown into the environment that get ingested by animals and get dumped into the ocean. And so there's actually four there's 4 levels of tobacco smoke of tobacco smoke. But again, the question is what are the secondhand? So secondhand cigarette smoke, can it cause lung cancer? Yes. Secondhand cigarette smoke, can it cause chronic bronchitis and emphysema? Yes. But what the effects of secondhand exposure to vapor from e-cigarettes? The answer is we don't know yet. So we will. Looking at regulation, FDA regulations require that manufacturers demonstrate their products to meet that the FDA standards, meaning they provide a net public health benefit. So far, like I said, the e-cigarettes were in the Wild West until 2016, but so far, no e-cigarettes have been reviewed or approved by the FDA. Regulation was supposed to be enforced by January 2021. So there's really no real regulation yet as far as meeting the standards of public safety. This was supposed to be national, but it never made it to be national. But the prohibition of the flavored I think this is the most dangerous part of it. Prohibition of the flavored cartridges, the candy flavor, the stuff that's going to get the kids addicted. They're prohibited in New York, New Jersey, Rhode Island, and California, but I don't know of any other states where they are prohibited. As of August of 2016, but not before, but as of August of 2016, age limit for e-cigarettes is now 18. You have to show identity in buying e-cigarettes. You have to show your age when you buy it at the store, and the store owners are responsible for selling them to adults, not children. E-cigarettes are now banned in traditional non-smoking areas and in airplanes. They're banned in vending machines. So there's a caveat to this. They're banned in vending machines except for adult-only venues. So I would think like gentlemen's clubs and stuff, maybe stuff like that. But you can't smoke an e-cigarette in an airplane or in a non-smoking area. And 5 countries have banned e-cigarettes completely. Australia, love Australians. Australia, Japan, Mexico, Costa Rica, and Sri Lanka.
China too.
China has 2?
Yep.
That's interesting. I think that's where it's actually started there.
Yeah, actually, I live in China, so
Yeah.
I used to smoke e-cigarettes back in years, but now it's banned. You can't even buy it anywhere.
That's great. How about traditional tobacco? That's still
Nah,
very
it's
heavy,
everywhere.
isn't it?
Yeah, it's everywhere.
Yeah, that's very heavy there. I think it's the cigarette companies have actually switched, from the U.S. to other places where they can sell they can sell death. It's all right. Thanks for that information. I appreciate it. I'll add it to the slide.
Yeah, sure. I'll send you even the link of that.
Okay, great.
It's pretty cool.
Okay, so this is another thing that became that I became interested in 2019. A new disease. I've been fortunate or unfortunate to be practicing medicine when new diseases appeared. When AIDS first started, when Legionnaire's disease first started. These were not in the medical books, and of course COVID. But EVALI was a new medical syndrome or disease, which was first described in 2019. So EVALI is e-cigarette or vaping associated lung injury or acute lung injury. So these are patients. I know you can't read X-rays or CTs yet, but this is a CT scan of a patient who has, it's all supposed to be black, but this is all, this is what's called ground glass. This is kind of this infiltrate that looks like you've crushed a juice glass on the X-ray, and you can see through it. But this means inflammation or infection, and you can see how both of these lungs are full of ground glass. This also could be COVID. I mean, the COVID could look like this also. And here, lower down here, this is more consolidation. This is more solid infiltrate like you would see in a bacterial pneumonia. If any of you listen to my pneumonia lecture, but this is like you would see in a bacterial pneumonia. This is ground glass up here, and here's nice black, normal looking lung, okay? So EVALI, so a new disease started, EVALI. So what is EVALI? So again, EVALI is e-cigarette vaping associated lung injury. More than 2,800 cases reported, including 68 deaths. The cause, why exactly some individuals get EVALI is difficult to determine. One of the reasons is that there's so many different vape brands, like more than 450, and flavors. Can you imagine 8,000 flavors? Plus all these illicit black market stuff on the that it's hard to figure out why this happened. And both on the internet and in different stores, you know, you could get both legitimate and illegitimate products. Reports of this disorder, reports of EVALI or acute lung injury did not emerge until the summer of 2019. Now, why is that? Did something happen in 2019, or did we just not recognize it? Because it looks like viral pneumonia. You know, it looks like, you know, it looks like non-bacterial pneumonia, and it may have just been, unless you put it together with vaping, the patients may have had it before, but they were just diagnosed as pneumonia of unknown etiology or viral pneumonia or ARDS of unknown etiology. So, but we did not, the actual syndrome did not emerge until July of 2019. So these are the characteristics of individuals with EVALI, with acute lung injury due to e-cigarettes and vape. They're young. The average age is 17 to 35. They're overwhelmingly male, 77%. Some of them had been vaping for days, some of them had vaping for years. The average time of symptoms before they presented for medical care was 7 days. Symptoms of this syndrome were dyspnea. Dyspnea means shortness of breath. Okay, about 80%, over 80%. Cough, 3/4. Constitutional symptoms. When we say somebody has constitutional symptoms, it means they just don't feel good. They feel weak and no appetite and have some fever. It's kind of like somebody coming on with a flu or a virus. That's what we mean by constitutional symptoms. About 60% of them had GI symptoms, and about 10% of them had hemoptysis. What's hemoptysis? Anybody know? Coughing up of blood.
Oh, I was muted. Sorry.
Yeah, hemoptysis is coughing up of blood, about 10%. Okay. So what caused these individuals, out of the millions of people who vape, what caused these individuals to develop, you know, this acute lung injury? And again, we don't know, but in these people who presented, about 90% of them had were vaping cannabis. About 7%, 70% were vaping nicotine, and about 8% were vaping CBD oil.
Huh.
I know Dr. Seam is very interested in this subject. So,
Sorry to interrupt you. What is the cannabidiol? The one that 8%.
it's a part. It's like a small part of the cannabis. It's like a 10%. It's a chemical that's about 10% of the marijuana that you buy. Not that you buy, but they can extract this out and legally sell. They have CBD oils. If you go to the store, just like any regular store, they sell CBD oils. They extract a small amount from the plant. It's not addicting, or it doesn't make you high, but it's supposed to have some therapeutic value as far as pain control. Some people use it for like fibromyalgia, chronic pain, arthritis pain, that stuff like that. So just next
Is
time
it
if you're allowed to get, next time you go into a store, you can have these CBD oils.
Yeah, I actually have that in this lip balm. I don't know if
It's
you
in
can
the lip.
see it.
It's in the lip balm.
Yeah, it's like you probably can't see it, but there's 30 milligrams of CBD. I don't know if it does anything.
What's it supposed to do in the lip?
I have no idea.
Okay.
Someone gave it to me as a gift.
Okay, good. Does it get you high?
No.
No.
Fortunately, no.
Okay. So of these individuals, okay, who presented with EVALE, 95% required hospitalization, 27% required intubation. That means that they were in an ICU and had a breathing tube inserted into their windpipe, into their trachea. Okay, that's when they're talking about what's going on now with virus, about patients that are intubated. These are people who actually have a breathing tube put into their trachea and then are hooked up to a ventilator. So about a quarter of these people required intubation. I'll be happy to, and 10 patients, it's not 10%, but 10 patients required ECMO, which is extracorporeal membrane oxygenation. They needed to be on a heart-lung machine, that their blood need to be directed outside of the body in order to be oxygenated and to have carbon dioxide removed. This is used, ECMO is used in extreme forms of respiratory failure. But 95% survived to hospital discharge, and again, 68 deaths reported in the United States. Obviously easy to miss because it looks like, if you didn't put it together with vaping, it would look like viral pneumonia, for example. So criteria for EVALE: you had a vape within 90 days prior to symptoms. Patients have pulmonary infiltrates on their chest X-rays. They had infiltrates, so you can see the X-rays here. This patient has more dense. This is consolidation. You might even see this in a bacterial pneumonia. Here you can see through the ground glass. These are called ground glass infiltrates. You see this a lot. And you see this in viral pneumonia, including COVID. And here you can see these. It's almost like patchy nodular infiltrates. So nothing specific. You can get all types of different infiltrates. Very important, absence of pulmonary infection. If you grow if you grow pneumococcus, or you get a PCR which is positive for a virus, then that's what the pneumonia is. But if the patient's vaped and there's no other, you can't grow out or do a PCR for the infection, then they have no evidence of infection or evidence of an alternative diagnosis. So there's no other reason why they should have lung infiltrates and low oxygen. Then and they vaped, then they can be called EVALI. And the pathology, there are few people who had bronchoscopic biopsies and a few people who had open biopsies. The pathology was very non-specific. I don't want to go into what the DAD is, diffuse alveolar damage or organizing pneumonia, but you can see these in a lot of different types of illnesses. So very, very non-specific. And if you do a bronchoscopy and get lavage, which is called BAL, bronchoalveolar lavage, if you do a bronchoscopy and get lavage fluid, again, some of these cases, they saw some blood, DAH is diffuse alveolar hemorrhage, lipid-laden macrophages. These are macrophages in the lungs, cells with fat. And, but again, nothing specific. Any questions? So you couldn't look at a biopsy or a bronchoscopy and say, oh, this is EVALI. You had to kind of put it together with this constellation of vaping, infiltrates, and no infection. Okay. The management for EVALI, supportive care. Supportive care means just support the patient. If they need fluids, give them fluids. If they need oxygen, give them oxygen. Steroids were used in most of these patients because we use steroids when we frequently, as physicians, we use steroids when we don't know what else to do. So, and if we have inflamed lungs, it's the same thing with COVID. Although they were using steroids, then they stopped using steroids, and then they have a study now showing that if a patient requires high concentrations of oxygen, that they actually will improve with steroids. But if they have early COVID and don't have an oxygen requirement, they actually do worse. So, but steroids are in the patients who got steroids, even though there's no studies, they seem to do better. Antibiotics don't seem to have a role, although some patients who develop respiratory failure for other reasons get secondary infections. So you could get, after 3 days on a respirator with EVALI, which is non-infectious, you could pick up a bacteria in the hospital and get a secondary infection. Up to now, no specific component or contaminant has been caused to identify this syndrome. But as you saw in this last slide, cannabis-containing e-cigarettes have been linked to most cases of EVALI, as has vitamin E. So vitamin E-laced vaping solutions have been suspected. Interestingly, vitamin E acetate has been found in product samples and in the BAL. That's the lavage, that's the fluid from the bottom of the lungs that we get with a bronchoscope. So vitamin E acetate has been found in a majority of patients who have EVALI. But if you do a lavage on somebody who has respiratory failure, but without EVALI, you don't have vitamin E acetate. So vitamin E acetate has been marked as one of the potential culprits. Although, we don't, again, a lot of these were sold black market, and we don't really know what's in many of these products. So conclusions that e-cigarettes are electronic devices that deliver a vape, which has nicotine plus other potential substances, which are vaporized with a heating element. Certainly not as many substances as with a standard cigarette. The main components of e-cigarettes are nicotine, propylene glycol, and flavorings, but other products are inserted both legally and illegally, including cannabis. Over the past decade, they've been around now since 2006, 2007. They weren't regulated until 2016. Over the past decade, the e-cigarette use is declining in adults, but increasing. This is the tragic part, increasing in middle and high school students. So the adult e-cigarette users of today are mainly using e-cigarettes to quit or cut down on conventional cigarettes. The kids are using it for flavoring, cannabis, or who knows what. Many of them don't even know why they're doing it. That would maybe be a question that some of you want to ask. Why are you doing it? How did you get started? And then the addiction, how many of you are really addicted to this? Adverse effects of e-cigarettes are related to exposure to nicotine as well as other vapor components. We don't have any long-term data. If you ask me what's the risk of lung cancer from e-cigarettes, the answer is, I don't know. It's probably a lot less than conventional cigarettes, but I can't give you an answer based on data. Since 2019, there have been over 2,800 cases of acute lung injury due to vaping called EVALE. Nicotine and vitamin E acetate, as well as cannabis, have been implicated. Illicit cartridges may also be contributing. Causes of EVALE are really declining. Interestingly, maybe it's just because of COVID, declining since 2019. Maybe people are people aren't paying any attention because of COVID, or maybe people are smoking less. Smoking is a significant risk factor for COVID. So maybe people are smoking less due to COVID. Clinicians, not only physicians, but clinicians who see patients, nurse practitioners, physicians assistants who see patients should encourage patients who want to stop smoking to use FDA approved means of quit smoking, like nicotine replacement therapy. But they shouldn't discourage e-cigarettes. If someone says, I've tried everything else and I think I'm doing better on e-cigarettes, they shouldn't discourage it. But you should inform patients that there's no long-term safety data and there's no long-term efficacy data on e-cigarettes. My main concern, I think it might be helpful in adults who have been smoking for 20, 30, 40 years to get them off standard cigarettes. My concern is that, after all this time that it took us to get the smoking rate down to 14%, now we have a whole new generation addicted, that's going to be addicted to nicotine through e-cigarettes. And certainly recreational use of e-cigarettes should be strongly condemned. The regulation of e-cigarettes varies greatly among cities, states, and countries. And we'll add China to our list of banned. Okay, well that's it. And any question? Tim, any questions?
Yeah.
Thank you. By the way, Tim, thank you for getting this all together.
Oh yeah, no problem. Yeah, it was like Min and Casey, Charlotte. They did a lot of it.
I thank all of you.
With the vitamin E acetate, do you think that's because of like the multiple aromatic rings in it that could cause problems?
Don't know if vitamin E is a problem, and I don't know why it's a problem, but it shouldn't be in the bottom of your lungs. It seems to be consistent. Yeah, you would have to do a bench research, or look up the effect of vitamin E. I think this does exist, Tim. The effect of vitamin E on the lung, or on other parts of the body in itself. I know it's used topically. It's used very, very often, but I don't know the reason. But vitamin E is a part of the lavage fluid, and it's been taken out of a lot of the cartridges, the e-cigarette cartridges, if there's vitamin E in it.
Because of the studies done on it?
I think it's something you have to look up.
Yeah, actually, I'm searching it now.
Yeah. Any other questions?
Oh, it produces a highly toxic gas called ketene. Inhalation of ketene can cause severe lung damage in concentrations and death in high concentrations. Oh, in low and high concentrations. Interesting.
Well, you have to see how they did those. Okay. So again, you're going to have to look and see how they did those experiments.
Yeah.
Yeah. Talk to me about it. That'd be interesting.
Yeah. Yeah, definitely.
I hope this subject was of interest to you guys.
Yeah, it is. It's very interesting.
I have a question.
Yes.
What would your advice be for someone who is living in an environment that is like you're talking about? You said third hand smoking, I believe. Like, what would your advice be for someone who's like in an environment that's just they can really do nothing but just breathe in the air? Like, is there any mask or anything that you would like advise?
No, there's so the third hand is just it's in the kind of the dry, it's in the dry wall. If you're the second hand smoke, is people are smoking, in your environment. In that case, I would get rid of them totally. I wouldn't be around people that are smoking. But there's really no treatment. There's no way of getting rid of third hand smoke, which is embedded in the walls, except to get rid of the scrub it off, or put up new drywall, or do something like that. And what the harm of it is, I'm not sure. We know what the adverse effects of first and second hand smoke is. We don't know what the adverse effects of third hand smoke are.
Okay, thank you.
Yeah, I wish I could give you some scientific advice, but I can't.
Yeah, that's an interesting question. It's like you're kind of stuck with that environment unless you do some serious change.
I mean, is it? Yeah, I mean, is it released from the wall? Is it released from the walls over time? I don't know. The answer is I don't know.
Yeah.
All right. Any other questions? If you guys have some topics, you tell somebody, tell Tim or tell somebody, and I'll try to accommodate you, with different topics. But I thought this was a fun topic, and we could all learn something from it. I know I learned something from just doing it.
Yeah. No, it was very interesting.
Okay. If there's no other questions.
I had a question, but I wrote it in the chat. I remember that lead in like paint in the walls
Yes.
would cause cancer. So would that be a similar way in which fourth degree exposure to cigarettes would cause like cancer?
It could. Well, I think the lead toxicity wasn't through breathing it. It was through the kids would eat the lead chips of paint.
Oh dear. Okay.
Yeah, it's not through, as far as I know, it's not through the breathing it. So, but there are formaldehyde. There was a type of drywall which was made with formaldehyde, which was, when it was put into a home, it would release fumes over time. And this, that would be potentially dangerous over time. So that is possible. But the lead thing was the ingestion of the lead.
Thank you.
Okay, sure. Okay, so I'll see you guys next time, okay?
Okay. Thank you,
All
Dr.
right.
Promisloff.
All right, take care. Yeah, have a good
Thank
day.
you.